centers because in April of 2010, I was at a place where I was ready to be done. I was in enough pain and my life had, as far as I was concerned, was over. I could barely even make it to work. And I was having so many difficulties emotionally, and I didn't know why, and I didn't want to do it anymore. And I was getting ready one morning, and I heard something on the television. I listened to the news in the morning, and I heard something about fibromyalgia, and so I'm so happy they have the backup button now. So I was able to back it up, and there was a doctor on there, and he was talking about the clinicals that they were doing, and they were wondering if, and they were saying, they were asking if they wanted to find someone else. Okay, you guys. They were looking for some volunteers to get on the study, and so I called, and of course, anyone with fibromyalgia knows that there's so many different people and things that they advertise, and none of them work, and you get your hopes up. So I was a little concerned. So I wasn't very nice when I called, and they just ignored my sarcasm, and we made an appointment. And what happened is I went in, and they were so nice. I walked in and I felt welcome, felt like somebody cared, and they sat down with me and asked me so many questions. And I remember some of the questions they had asked me, no one had ever asked me, and I hadn't even put it into words and didn't even realize that those were some other things I had lost. I was quite athletic when I was younger, and I was a single mom, and my daughter and I used to go hiking and play, and we were in Colorado, so we had a lot of things to do. We came out here, and I had gotten worse, and that was one of the reasons why we came out here. And it ended up that I couldn't play with her. I couldn't do anything with her, and she became somewhat of the parent. So through those questions, I was able to realize how bad it got. But while they were asking me the questions, they were talking about the product that they had, this LiquidCMO. And they were telling me I didn't have to do anything. I just had to do a tablespoon of this stuff a night. I couldn't have nicotine, and I couldn't have caffeine 3 hours before, after. And it was, well, I could do that. And that I didn't have to take this medicine, that I had come to realize that the medicine that I was on was changing me mentally and emotionally as well. I was going into rages. Thoughts of suicide were becoming not just thoughts, and there was nothing else I could do, and I had been told this was the last medicine. I wouldn't go on the opiates. I wouldn't go, I'm pretty stubborn about what kind of medications I will put in my system, so I just tried to live with it. What happened is I went there on April 19th, and the reason why I remember it is it changed my life. Within 6 days of what they told me, and I had to call them every day. I talked to someone every day. Someone called me, or I called them to follow up. It was like they cared. And I would tell him that the silliest things, like I dried my hair without having to stop 3 times. I got all the way through it. I was able to start curling my hair. Within a few weeks, I was wearing high heels. I would go back to the center, and then we would go through some more questions, and then they offered me other things that would help, and I would tell them I was having symptoms with this or that. And I had a couple of vitamin bags, which I had never heard of. I also was able to get massages, which help clean some, I don't know what it is that's in there, but it comes out. I have to drink a lot of water, otherwise I get sick. I was able to go to work and last the whole day, so I don't know. I still have my job. They didn't fire me. I didn't get in a fist fight with anybody. That medicine was horrible they had me on. So I'm really grateful that I only have to take a tablespoon of this stuff every night. And through the years, I could take it every other night, or maybe even a third night. and I am pain-free. Do I have other issues? Yeah, I'm getting older. I keep getting surprised every morning something's changed, but I was able to get off the medication. They helped me wean off that medication, and I was off of it fairly quickly, and then I had to get it out of my system. But I don't go into rages anymore. I do want to live. I have grandchildren that I couldn't lift up or play with, and now I lift them up and play with them, and they're my joy. And there's other things that the doctors at the center want me to do, like my weight. And I kind of enjoy food now, and I kind of want to do what I want. So I don't always do what they ask me to do, but I'm so grateful. I do have my life back. I laugh out loud, and I don't stay home every day. I don't sleep all weekend just so I have enough energy to get up in the morning on Monday to go to work. I can't recommend AZ Fibro centers enough. Just go. If you just go, have them ask you the questions and make a decision at that time. All it's going to cost you is an appointment in time, and we've done that. People with fibromyalgia has done that, and we've walked out with nothing. We've walked out with another prescription for an opiate, or a prescription that is going to cost us another $75, and we don't even know if it's going to work. We do know it's going to change us, but it doesn't mean it's going to take the pain away. The only way I can say that you should do it is just, it's an hour of your life, and it's an appointment, and whatever the cost that is, and then you can decide. I know that I tell my friends that I have a friend that has a fibromyalgia. I just think that if you want to live with the pain and you want to live with the not having a life, then that's your choice. But I choose to lift my grandchildren up and love them and hold them, and all it cost me in the beginning was an hour, 2 hours of my time.